Good afternoon. It is Friday, and that means it's time for our Lunch and Learn. And today I want to talk to you about, of course, the COVID virus and vitamin D and your vaccinations. Okay, so we're getting a lot of information, and I'm not going to be posting. I don't think we have any links that I want to post today, but you'll be able to look at this. You'll be able to do your own research and see kind of what you think about this. But one of the things that, you find out things through reading, you find out things through listening, and sometimes you find out things through your friends. And so I do have a very close friend that I've known for approximately 20 years. And she's a nurse herself, and she has a sister who's a nurse, if I remember right. Anyway, she had her first Pfizer vaccine about 10 days ago. She started having some symptoms. She had her second vaccine, I think this week, and wound up in the ER with blood clots. So wanted to just kind of track with this on what you can do, what kind of information you need to know. And I don't know all the information anyway with this particular case, but one of the things that was brought out in my discussion with my nurse friend is that medical people, they know that there is an interaction with the vaccine and birth control pills. So, PSA, if you are having a vaccination, a COVID vaccination, and you are currently taking birth control medication, then you need to tell the doctor, because there seems to be I don't know if it's a cause or if it's just an effect or what it is. I mean, we don't know a whole lot about these vaccines right now, but there is some kind of a connection with negative consequences with birth control pills and these COVID vaccines. So if you are a fertile woman and you take birth control pills, before you go and get this vaccine, be sure and tell your medical professional that you are taking birth control pills. Now, I want to give you an article. I've got two articles here, and it is about vitamin D and how an adequate level of vitamin D in your blood can ameliorate the symptoms of the COVID virus. So this is something that's really, really important. Now, when I ask for blood work, and we always want blood work, so if you're out there and you think that naturopaths don't want to see your blood work, let me tell you, your blood work tells us what your chemistry is. Your chemistry is your history. What is the state at this point in time with your body? And so we want to know that, because you might come in here and you might be saying, I feel great, there's nothing wrong with me, I just want to have an assessment. Well, okay, fine, but if we run those lab values through our software, it's going to tell us if you are in the optimum range or if you are out of range. Now, our out of range is trending for disease, whereas the medical reference range, if you're out of range, you are already in a disease process. It's much easier to reverse a trending toward disease than it is to actually get you out of a disease process. But it is possible. It just takes longer. It's more expensive and that kind of thing. So when you bring me your blood work, we're able to cut to the chase and say, oh, well, there's this, 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 and this that needs to be addressed, and it just helps us to do better. Well, one of the things on the blood work is your vitamin D. Most doctors will not ask for vitamin D on your regular labs, and I do not know why. You know that we can order labs on our website, www.polyheilmealey.com. Go to the top of the menu page. There's a links tab. You click on the links. The very first option you're going to have is to order blood work, and I believe that a vitamin D test is only like $39. So it's not very expensive at all to find out what your vitamin D levels are. I will tell you, back in the day, I don't remember how many years ago this is, but the first time I had my vitamin D checked, my vitamin D was 18. I was horrified, okay? This is a girl that grew up on the lake. I would go outside in the summer. I would, lather up with baby oil and all that kind of stuff to catch the rays. Not that I'm saying that that's a good thing to do, but we were young and dumb and didn't know any different back then. And I was brown. I had a suntan year round and that kind of thing. And so as I got older and thought about vitamin D, I thought, I've been out in the sun. We had a boat. We water skied. I sunbathe every summer, and I live in South Texas, so it's easy to get a lot of rays. So I was not even really cognizant of the fact that I had a vitamin D issue. On your medical reference range, they want your vitamin D to be above 30. Now, we holistically want it to be above 60. Now, the reference range that the blood work shows is nanograms per deciliter. So we want you to have 60 or better nanograms per deciliter, right? You don't really even need to know what all that means. What that means is you need to have a lot of vitamin D. When you have a lot of vitamin D, and people don't really know what vitamin D does, but some of the things holistically that it does, it prevents you from getting into depression. It can prevent certain types of cancers, and it can prevent the annual cold and flu. So this is really, really important when we do our COVID protocols. And you've heard this, if you're doing any kind of research yourself at all, you're hearing holistic doctors say, get your zinc up, get your vitamin C up, get your vitamin D up. Okay, get your antivirals. We do wild oregano oil, not the essential oil. We do a different part of the plant, but it is an antiviral. Lapacho herb is an antiviral. Liquid silver has antiviral properties. So anything like that, we want you to do to get your immune system ready and on alert for any kind of viral invasion. But unfortunately, your medical doctor usually will not order a vitamin D panel. I do not know why, because it's not that expensive and it tells us a good deal about your health. So this is an article from the Royal College of Physicians. It is a PubMed article, and so you can find it there. And the question that it asks is, does vitamin D deficiency increase the severity of COVID-19? And this is part of what it says. The severity of coronavirus 2019 infection, COVID-19, is determined by the presence of pneumonia, severe acute respiratory distress syndrome, myocarditis, microvascular thrombosis, and or cytokine storms, all of which involve underlying inflammation. The principal defense against uncontrolled inflammation and against viral infection in general is provided by T regulatory lymphocytes, or I don't know if they say Tregs or Tregs, whichever way you do it. Treg levels have been reported to be low in many COVID-19 patients and can be increased by vitamin D supplementation. Low vitamin D levels have been associated with an increase in inflammatory cytokines and a significantly increased risk of pneumonia and upper viral respiratory tract infections. Vitamin D deficiency is associated with an increase in thrombotic episodes, which are frequently observed with COVID-19. Now, a thrombotic episode is a blood clot. Okay, so remember I was telling you about my nurse friend and her sister. This girl has a lot of blood clots in her lungs. Okay, I don't know what her vitamin D level is. That's something I'm going to circle back and ask, just because I just want to know for research purposes. She is, by all intents and purposes, very healthy. Her own medical team say she's very healthy, and they're very, very surprised that a very healthy young person, how young she is, I don't know. She's premenopausal age, so I would say she's below 50, okay? And remember, COVID-19 takes people out when they are older. And so here we've got this young, vibrant healthcare worker that is very healthy, but she's got multiple blood clots in her lungs, which of course is a very, very serious condition. It says these conditions are reported to carry a higher mortality in the COVID-19. If vitamin D, in fact, were to reduce the severity of COVID-19 in regard to pneumonia, the acute respiratory disease, inflammation, cytokines, and thrombosis, it is our opinion that supplements would offer a relatively easy option to decrease the impact of the pandemic. So these are medical people who are saying, look, this is what happens with this disease. If vitamin D can do all this, and it probably is a good idea to supplement this. All right, and so it goes on and it says specifically, TREG levels can be increased with vitamin D supplementation. The importance of vitamin D in cases of respiratory infection is illustrated by the fact that low vitamin D levels are common in populations worldwide, and low levels have been associated with a significantly increased risk of pneumonia and viral upper respiratory tract infections. Vitamin D deficiency is present in 30 to 60% of the population in Western, Southern, and Eastern Europe, and up to 80% of the population in Middle Eastern countries. Now, I find this interesting because vitamin D is what? It is the sunshine vitamin. So you would think the lower you are to the equator, the closer to the equator, the more sun you would get, therefore the more vitamin D that you would get naturally. We're going to get to some statistics in that in a minute. But through the research, and we've been doing COVID research for several months now, one of the things that we know is that dark-skinned people have a worse outcome and a more severe COVID infection. Why is that? Nobody really knows for sure, but we do know that dark-skinned people do not translate the sunshine into vitamin D in their skin. So it has to do with the amount of melanin that you have in your skin. Now you would think God gives us more melanin because we're closer to the sun, because we're closer to the equator, therefore we would not have a problem, but unfortunately there is a problem, maybe because it is that protection, okay? It says, let me see, where was I? Okay, thrombotic complications are also common in COVID-19 patients. Of those with severe disease, over half have been found to have elevated D-dimer levels. Now, this is a blood test that my friend's sister did have. Apparently, normal is 500, and sister's was 4,600, so that's quite an increase, okay? Interesting, vitamin D is also involved in the regulation of thrombotic pathways, and vitamin D deficiency is associated with an increase in thrombotic episodes. Vitamin D deficiency has also been found to occur more frequently in patients with obesity and diabetes. Now, we know with COVID that your comorbidities, obesity and diabetes, hypertension, COPD, all mean a worse outcome for COVID-19. All right. Back to the melanin. Melanin reduces the production of vitamin D associated with exposure to ultraviolet radiation in sunlight. This may help explain the observed frequent occurrences of vitamin D deficiency in the minority groups. Okay, so that's something that's really, really important. Just want to talk to you a little bit with your anatomy and how vitamin D works if you take it as a supplement. Now, number one, if you supplement with vitamin D, you need to also make sure that it has vitamin K2 in it. Why? Because that is a cofactor that helps the vitamin D get absorbed into the bloodstream. Now, if you take a pill, and a lot of times if you go to your medical doctor does say that you have a vitamin D deficiency, they're going to give you a 5,000 IU tablet to take once a week. So, not 5,000, 50,000. Okay, 50,000 IU. Now, people say, oh, but Dr. Polly, that's just a huge amount. Well, yes, it is, but you're not going to be absorbing that much. It goes in, you're going to do it orally. It goes in, goes through the stomach, gets chewed up by your hydrochloric acid through digestion, okay? Then it goes over into the liver. It gets chewed up by the liver. Then it goes via the blood into the kidneys, and this is where the body absorbs your vitamin D that you take it orally. There's 3 different kinds of vitamin D. Don't want to kind of get into that because I'm not prepared to go into all those little intricacies. But the point is, your medical doctor is giving you 50,000 IUs because that's how much you need to have sufficient vitamin D get to the kidney where you can uptake it into your bloodstream, okay? Now, We here at the clinic have a beautiful spray. You spray it right into your cheek. It is a liposome spray. It goes right into the bloodstream, right in your cheek. Each spray is 1,000 IUs. So I do typically 10 sprays every day, and I'm going to get to the reason why I do that in the research here. But it's 100% absorbed. There's no waste. And we have seen clinically that when someone comes in and their level is X, and usually it's a low, we supplement them at a very high rate, and usually within 60 days, their numbers have moved into the optimum range. So it is a quick turnaround, and there is no waste. And this is what people, you know, they don't want to do vitamins, they don't want to do supplements because they don't feel like they do them any good. They don't feel better when they take them. Their blood work is no different and that kind of thing. Well, when you look at your supplements that you're getting in the big box store, you look at your supplements that you're getting from Amazon, which I do not recommend, okay? There's a lot of counterfeiting out there, and the good guys do not sell to Amazon. So if you are buying from Amazon, you are getting a counterfeit product, or you're getting a product from someone who's had it on their shelf for too many months, and it's probably lost a lot of its efficacy, and they're trying to offload it on an unsuspecting public person. So please get your supplements from somebody that is qualified, all right? So this is an article, and it was in the Epic Times, and the title is, Why Are We So Vitamin D Deficient? And so, as I said, being in South Texas, going out in the sun, being in the sun all the time, it's hot, you can hardly breathe outside in the summer, right? You would not think that we would have vitamin D deficiency, but we do. And so here is what this article says. It says there are many benefits of vitamin D and many risks that come with vitamin D deficiency. Many people don't have enough of this easy to get vitamin. The sunshine vitamin supports the musculoskeletal system by regulating calcium for optimal bone strength and density. So if you have osteoporosis, guess what? You probably don't have enough vitamin D. You probably don't have enough estrogen either if you're a postmenopausal woman. I'm just going to throw that out there, okay? Because that has a lot to do with osteoporosis with us older girls, okay? It enhances muscle tone. Vitamin D also regulates the immune system by reducing levels of certain inflammatory cytokines and reduces the risk of certain cancers as well as cardiovascular disease. Okay, so that's really, really important. It is essential that we get enough of our vitamin D. It says, it says, we do not go out in the sun enough to get adequate amounts of natural vitamin D generated by the sun. The second is that dietary recommendations for vitamin D, specifically intended for those who don't get vitamin D for sunlight, are wrong. And so this is what I wanted to talk to you about. Our recommended daily allowance for vitamin D is 600, what does it say here? I think it's 600 micrograms, I think is what it says. The researchers found that you need 10,000 international units in order to maintain the level that you already have. So this is one of the things that when people come in, and you may have done this yourself, you go into a clinic like mine, or you go into a really good health food store, and you're looking at your vitamin, and you're looking at the ingredients on the vitamin, and it says 1,000%, or it says, 500% of your recommended daily allowance. Well, unless things have changed recently, the recommended daily allowance was established in the 1960s. Here we are in 2021, and things are different. Why are things different? Well, things are different because our food is not as nutritionally dense as it used to be, okay? Things are different in that we are bombarded every day with electronic magnetic waves, electromagnetic waves from our Wi-Fi, from the generators, from the 5G, from all that kind of stuff. Those kind of things we didn't have back in the 1960s, okay? Remember, I think it was in the 1980s, we had the cell phone that was, like a shoebox, okay? And so a lot of things have changed in our environment, but it hasn't changed the RDA has not kept up with that, okay? So, a pale young adult white person, okay, in the summer sun will produce 10,000 IUs of vitamin D within 15 minutes, okay? The Institute of Medicine, National Institute of Health Office of Dietary Supplements has determined that the recommended daily allowance, RDA, is only 600 IUs, okay, so not milligrams, IUs, per day is required. Why are these values so far apart? All right. They say studies have shown that 600 IUs per day is only about 1/10 of the amount needed to support vitamin D levels linked to reducing the incidence or risk of disease related to vitamin D deficiency. So, how did they get this so wrong? All right, there's a lot of information in here that I don't necessarily want to go through with you because it's just a lot of scientific stuff. Just understand that you need, in order to maintain a healthy vitamin D level, you need 9,000 to 10,000 IUs per day. Your body, we're going to get to this in the reading, okay? Investigators from the University of Alberta published a paper in the Journal of Nutrients, in which they showed that the calculations had a statistical error in defining the intake needed to reach and maintain a vitamin D level of 20 nanograms per milliliter. Now, on your blood work, unless it's changed recently, it used to be nanograms per deciliter, which you'll have to figure that out, okay? Had it been calculated correctly, the RDA would have been 10 times greater and in agreement with the research. So these researchers used these studies and they determined that 8,895 IUs of vitamin D per day would be necessary to achieve the proper reference range in most of the population. They found that 7,000 IUs would bring 97.5% of the people up above that minimum 20 nanograms per milliliter. Those that did not get enough of vitamin D from sun exposure due to indoor lifestyle, time of year, sunscreen use, etc., must supplement to get adequate vitamin D. Conventional thinking, this is what you and I think, okay? Not you and I, because we're smart and we watch this program, okay? So conventional thinking among vitamin D scientists and physicians is that between 3,000 and 5,000 IUs per day is appropriate for most healthy adults. While these amounts may seem like a lot, keep in mind that your body uses 4,000 IUs per day and that the skin can generate 10,000 IUs of vitamin D after only 10 minutes in full sun exposure with no sunscreen. Nobody is going to get burnt outside, even in South Texas sun in the heat of the summer. Nobody's going to get burnt in 10 minutes. I'm just saying, it's just not going to happen, right? After your 10 minutes, when you have produced all the vitamin D that you need, then you put your sunscreen on and you limit your time outside, okay? So we don't want you to get melanoma and all that kind of stuff. What we do want is for you to build up those stores naturally, okay? So, despite what you may have read about vitamin D toxicity, it is very rare, okay? They even say, go ask your doctor how many times he's seen vitamin D deficiency because it is extremely rare. They say you have to be taking 30 to 50,000 IUs per day in order to reach vitamin D toxicity, okay? Nobody's going to do that. Nobody's going to do that. You can be out in the sun 24/7, okay, depending on your skin type, right? You will never make more than the adequate amount of vitamin D that you need. You're not going to get vitamin D toxicity from the sunshine, okay? So that's really, really good news because we want to make sure that our skin gets what it needs from the sun because that's really important. it says when there is a rare instance of somebody having vitamin D toxicity, they just quit supplementing and the body uses what they have, and it's not like a death-causing thing, okay? Not that we want you to be vitamin D over the top. We don't want you to. I think the highest level, we've been doing this in the clinic for over 10 years, the highest vitamin D level I've ever seen was 92. My vitamin D level last year was 82, okay, which is very, very healthy. We do see 12. I've seen 9. I rarely see anything above 82, which is what mine was. Sometimes I see 50s, sometimes I see 60s, but I rarely ever see anything above that. So trust me, nobody is getting too much vitamin D. If we are wanting to protect ourselves against the COVID virus, it would be well for us to be taking vitamin D so that we can have a inflammation suppressant, so that we don't have this cytokine storm, okay? This is what causes the thrombosis and all that kind of stuff. So if we have vitamin D at a sufficient level, then we're not going to have that severe disease. And that's what we want, okay? This is what we want. And this is why I'm bringing you this information, so that you can be your best health advocate, okay? Remember, COVID-19 is still 4% curable, okay? It's non-lethal to most people. Now, we know people that have died, of course. I know people that have died. You know people that have died. But for most people, it is a non-event. That's why you have asymptomatic people that are out there, okay? So you might wonder, and I wonder, are those asymptomatic people that have a very high vitamin D level in their blood, okay? So that's just something to think about. And so I want to end with this little funny thing, because I thought it was funny. Why do cold-blooded animals sun themselves? To get warm, right? Wrong. Lizards, and we all have seen lizards out there sunning themselves on the rock, right? Lizards injected with vitamin D prior to being placed in the sun do not sun themselves as long as lizards who are injected with a placebo. Furthermore, the effect is dose dependent. The more vitamin D that is injected into the lizard, the less time it spends in the sun. The lizard is responding to its blood levels of vitamin D and regulating its sun exposure based on those levels. The lizard is smart enough to go into the sun to get its vitamin D. So are we as smart as a lizard? Okay, so that's just kind of struck me funny, because I don't really think that lizards are all that smart. But if they go out and sun themselves, and I thought they go out and sun themselves because they're cold-blooded and they're sluggish and they need the sun in order to get moving, right? Well, that may be partly true, but more importantly, they're out sunning themselves because they know that they need that vitamin D. So I'm going to say go out and be like a lizard, but in South Texas, we're having below freezing temperatures. So that won't be great for you this weekend. But I want you to remember this for the summer. And until then, supplement with your vitamin D. One of the headlines that I read this morning was from a group of doctors, and it says that COVID-19 is going to become endemic. That means it's going to be like the flu. It's going to be like a cold. It's going to be something that people face year in, year out, year in, year out. And the article said that we have to learn how to live with it. One of the ways we learn how to live with it is to get our vitamin D at optimal levels. So hopefully you found this interesting. Hopefully you found this helpful. And vitamin D is not all that expensive, you know? Going to the doctor, being in ICU, all that kind of stuff with a COVID infection is very expensive. But if you can just increase this nutrient, you could save yourself a lot of hassle, and you could save your family a lot of hassle as well. We love you. We care about you. Get some rest this weekend. Bundle up, because it's, like I said, it's going to be below freezing here in South Texas. We love you guys, and we will see you next week. Thank you so much for watching. Thank you for sharing. I appreciate it.